Hi, how are you?
Good. How you doing?
Fine. So good to have you here. So let
I'm
me
excited to
intro.
be in Panama.
Yes, this is Raul is also a icon. He does a lot of stuff, and he's very special urologist. So he's gonna told us. Hold on, just a second. I don't know what's going on here. That okay. Rahul, why don't you intro? You send me your video. No, you introduce yourself. What I can say is he's such a special person too. All the people here are very special to me. I like him a lot, and he really teaches that urology can be fun too. It must be fun because we need to transmit this knowledge we have to everybody. And there's a segment of the population, students and patients, that just couldn't get what we do here. They can't. And he's helping us and he's teaching us lessons on how we promote urology and ourselves. Welcome, Rahul. Please, your short bio for me, for us.
Thank, thank you. All right, let's talk about social media. I'm so excited. Okay, slideshow. Can you see this? Are my slides up? Okay, I'm gonna go. So let's talk about this. I'm Rahul Mehan. I'm a urologist in sunny Arizona. I'm in private practice. These are my social media handles. I'm on Instagram, X, LinkedIn, and TikTok. My disclosures. So this is what a lot of people don't understand. A lot of doctors look at Twitter, X, and LinkedIn as the places to share content. And I think this is where doctors go to talk to doctors. This is where we share a passion, where we learn from our colleagues, where we build relationships. But where are our patients? Our patients aren't on those channels. They're on Facebook, they're on Instagram, and they're on TikTok. And this is where we need to go and engage patients. We need to provide the content there. And the key really for social media, which is beautiful, is short form video. People want to see things. They just don't want us to talk about it. They want to see it. They want to visualize it. Um, in America, did you know 1 in 5 Americans will consult TikTok before their physician for health advice? And patients are less likely to research WebMD. They want to see it. They have diminishing attention spans, and they want to see their doctor before making an appointment. They want, our CVs are now digital CVs. They want to see us on social media and know who we are. And I think that makes a huge difference. So I'll give you an example. In today's world, when people go to TikTok, they don't learn the right things. There's so much misinformation out there. This is one of my most interesting. Oh, hang on, let me go back for a second. One of my favorite studies. I saw this a couple of years ago. This was an article in 2023, and they looked at TikTok and they wanted to see how accurate it was. And they looked at it from a kidney stone standpoint. What do we what do we know about kidney stones? And they found 131 videos talking about how to prevent kidney stones, and 87 of them kind of fit the criteria of what their inquiry was. And that led to 8 million views on kidney stones. But only 8 of those videos were created by physicians. Everything else came from somebody else. And a majority of those videos failed to match our recommendations regarding diet therapies for stone prevention. They gave this wild results. And I read that article, I saw that, and I said, we could do better as doctors in educating our patients, our community, the world. We're just not on these platforms. So this is what I've done. I'm going to kind of share. This is my Instagram. I'm Dr. Mehan on Instagram. I love it. This is my TikTok, which is a little more wild, a little more crazy. I'm saved by the balls on TikTok. And these channels have really allowed me to reach out of my normal community, my normal sphere that I interact with. These platforms use AI discovery engines. And the key is for us to make content that fits into their criteria so that it can be served to patients anywhere that's looking for answers. We need to be the ones running those answers. And the key for this is short form videos of high relevancy and a more personalized approach. We want to focus on quality first. And these platforms will bring our content to people who are in need. It's funny. You start thinking about things and talking about it, your phone's listening, and it's going to find the content that you're thinking, talking about, and then serve answers to you. We need to be the answers. We need to have that content. So I saw this and I said, I'm going to make videos on kidney stone prevention and talk about kidney stones. And I got to make it kind of funny. So this is the first video that I put out. And I don't know if you'll be able to hear this. Let's see here. I don't know if you can hear the music, but we're sharing screen. Let me see if I can share my sound. Oh, I'm not sure if it's working, but you get the idea. I said, I want to show what a kidney stone is and compare it. Um, Here's a piece of a candy, a nerd's candy. I put this out, and immediately there's just no content on kidney stones. I put this out a couple years ago. This has 42 million views. Crazy. That's how interested people were just on kidney stone content. So I was like, you know what? I'm going to start making better videos and educational videos. Like so in on all of TikTok, there's only 8 million views on kidney stone prevention, and yet a huge percentage of the world are going to get kidney stones. And you start talking about prevention, there's stuff that's just wild on social media. So this is a video I made. I made a video on 5 ways to prevent kidney stones from urologists. These are in our AUA guidelines. I just said, I'm going to make a video, short form video, make it highly relevant, make it direct to patients, make it easy to understand. And I shot this on a Sunday after church with my son, he filmed it for me. And this video has like 5 million views. Drink more water. People who produce AUA gallons there, 2.5 liters of urine daily are 50% less likely to make a kidney stone. 2, limit salt. Salty food increases the amount of calcium in your urine, target under 123 milligrams. 3, calcium. Calcium is good. It's good for stones. 4, avoid high oxalate diets. I tell my patients to avoid almonds and spinach. And have more fruits and vegetables. Not rocket science, pretty easy. This is heart healthy stuff, and it helps prevent kidney stones. Beautiful. And it's interesting. So why social media? Where are the people? Well, they're on Instagram, they're on TikTok. That's where they're on. But more importantly, this is where the engagement rate is. So this is something that a lot of people don't understand. When you look at engagement is defined as sum of likes, comments, and shares divided by the number of posts, divided by the number of followers. When you look at Instagram's at 0.6%. So everything you post, 0.6 of people are going to engage with it. Facebook's at 0.15. Twitter or X is 0.05%. Nobody's engaging on X. And then out of those platforms, it's the video content that goes the best. So Instagram Reels, best performing content type on Instagram, generates double than the other posts. Instagram Reel engagement rate is 0.93%, significantly high. When you look at TikTok, launched in 2016, you had 1 billion followers by 2021. I mean, this is one of the fastest growing social media platforms. It sucks you in. It has the best engagement rate. That engagement rate is 4.25%. This is where we need to be in the urology. We need to be on TikTok. That's where the people are. And it's the highest average social length of social media views, 11 minutes. If you have a bunch of active users, it doesn't mean as much as they're not engaging with the platform of creators. And it's not just for teenagers. When you look at TikTok and you look at the demographics, a large number, 21% are 30 to 39, 20% are 40 to 49, 11% are 50 plus. You have patients of all ages. So you don't have to necessarily look at kids on TikTok. This is where I spend my time. This is where my parents spend their time now. And it's interesting. This is the best place to engage patients. You can look here. It's just off the charts. So I love it. So I've used this after I did the kidney stone stuff. I was like, I'm going to do everything. Like for me in my practice, I do a lot of men's health. I do prostate cancer, I do BPH, and I wanted to explain difficult concepts and make them simple that people can understand. So this is one of my favorite videos that I did. early on when I started. I did haiku for years. Don't do that much anymore, but this is interesting. I talked about haiku, how it kills prostate cancer, and how you can do focal therapy. And I have my friend Kevin Zorn here who says, "Excuse me, the steak is fantastic, except for this one spot." And brings it to me. We shot this. He was watching Cases for the Day, and I had a old piece of steak, and we cooked a spot of it with the probe, and then I take it back to him, and he eats it, and he says, "That's delicious." That easy, and that video doesn't have that many views, but it probably has a couple thousand views. But I've had so many people from all the United States see this, and they're like, "That makes sense. Like, why take out the whole prostate? Why radiate the whole prostate when a lot of men have just a spot of cancer? Focal therapy makes sense for the right patient." Um, Tips of social media. These are my 5 tips for you guys. In order to educate, you're going to have to entertain. You're going to have to get out of your comfort zone. The stuff that I post that I think I'm like, oh my goodness, I'm a little nervous about posting that. That's when you know it's good. You want to make content that's unique to the platform. TikTok has its own trends, and you may want to get a social media consultant, somebody, a young person to help film and to help produce and help think of ideas. But they're best for tell if you do them yourself. You can add your own passion of what you do and your own knowledge of what you do, and then combine that with some of the newer trends. That's what really goes far. And that's what gets into AI. Ask your kids, you know, what's in right now, and they'll help you. I have 5 kids, and they're all very helpful. They send me stuff all the time, what to do. We're all excited and engaged in this together. 3, speak to what you know. Your niche and understandings will resonate best. Do what you love. You know, one of my really good friends is watching this. Art there. He's the man. He's the guy. He does focal therapy. He does PAE. I would love to see him on TikTok. I'd love to see him dancing about this stuff and doing things and engaging patients. I mean, that would be awesome. 4, don't let likes and followers become your main motivation. I have a really good friend, Kevin Zorn, who's one of my videos. And when he launched, he started doing all these things too a couple of years ago. And he was like, "Hey man, I'm not really having that many followers or engagement. Like, don't worry about it. The numbers are nothing. It's a start is a start, and it's fun to watch his channel build. Now he has momentum, and he has patients from all over the United States and from Canada that find him and get treatment at BPH Canada. It's awesome to see, and really social media has been impactful in his practice. And number 5, understand your context. Physicians will be scrutinized. Understand the expectations of your patient population, local colleagues, or administrators. If you work at a hospital, you can't be filming at the hospital unless you have their permission. Um, for patients, you don't really want to show patients or have them on there unless they give their consent. And us, like, I don't want to post something and come to a conference like this and have people be offended. You know, I want to make my stuff fun and light and easy to understand, but understand your expectations and the people around you, because you are going to be scrutinized. Doctors are going to be scrutinized. We have a target on our back, but we want to, still engage patients. And really, really, we could be the ones making that dialogue and progressing it. Some other tricks that I have. A lot of times we have our own content. You've already filmed things, and I've been on a lot of podcasts, and I've taken some of those podcasts and cut them up. And this is one of my favorite videos that I made on testosterone. This one has thousands of views. But I talked about 8 suggestions on how to naturally boost your testosterone. I gave a talk for like an hour, and I cut out just one little bit. And we talked about just some basic things and some healthy things, talking about nutrition, exercise, talking about sleep, avoiding stress. And I think those are things that the community, they need to hear from us as doctors. It's not rocket science. It's not like a secret about any of this stuff. But sharing that and talking to people go a long way. When people hear from us as doctors, they're more likely to internalize and follow those recommendations and make it fun. This is my favorite thing to do. If you follow me on social media, I bring all my partners and all my colleagues into my TikToks and Instagram, and I love it. And we have fun with it. And as a group, I started my practice in 2017, and now we're 9 doctors, 4 offices. We've grown like crazy, and it's because we have fun and we enjoy each other. And like we met this last Monday. I told everybody to come at 6:30 a.m. before clinic, and everybody showed up. We filmed. Um, And we've done wild things. This is one of my favorite videos. I don't know if you can hear the music, but this was a trend on TikTok where you went to a car wash and you guys washed each other playing to this song. And I was like, it's kind of like BPH. We're helping people flow. So I brought all my partners back then, and we did this with the metaphor of helping people urinate better. And it resonated to me, but it really made us as a group stronger. And the bonds that we have as partners is forever. Um, and I love it. And that's my talk on social media. I want to see all of you guys on social media. Do it. I love it. I love Ingrid. She had an awesome resume video the other day, and it resonated with me. And I want to see everybody progress and do this, and we can change the world together. Thank you.